Uh, my name is Pradnya More. I am from Shivaji Rao Zunre College of Pharmacy, final year, and the topic is review on optimizing diabetic foot ulcer healing, and which is guided by Assistant Professor Pooja Surve ma'am. Next of that is whenever the soft tissue damage results in several extremely expensive therapeutic therapy and the microvascular consequences of diabetes mellitus resulting from the neuropathy damage deformities include the diabetic foot ulcers, peripheral artery disease, and the elevated plantar pressure that results in lower limb amputations due to the aging of the population. Extended hospitalization has increased the patient morbidity from the diabetes mellitus during the past few decades, and the complications are not influenced by the time but rather by the level of the chronic glycemia. So the diabetic foot ulcers are results of the acute and there is a chronic injuries to the foot soft tissues in patients with the diabetes, which is commonly accompanied by the signs of neuropathy or the ischemia. Accurate diagnosis accounting for 70% of the lower limb amputations requires a thorough examinations that includes microbiological investigation, clinical assessment, and imaging studies. Myelopathy is a serious consequences, affects 71 out of 41 people with ulcers on the soles of their feet due to unrecognized trauma, which often remains painless even in the cases of gangrene. Recommendation also exists for the antibiotic therapy based on the infection severity. And the causes of the diabetic foot ulcers is can arise from the poor blood flow, nerve damage, foot deformities, and the repetitive trauma. Next of that is the diabetic foot ulcers are involving a persons with a diabetic organizing originating in chronic or the acute injury of soft tissues of the foot with evidence of pre-existing neuropathy or ischemia. There are the two classes of the diabetic foot ulcers, which is mostly based on the Wagner classifications, which is intact skin, superficial, deep tendon, osteomyelitis, gangrene of the toes or the forefoot, and the gangrene of the entire foot. Next of that. There are the several stages for the diabetic foot ulcer healing. Next slide. So the firstly, the superficial callus may grow as a result of aberrant pressure on the foot that is not felt when we are wearing the weight because there is a lack of sensation. The first indication of the diabetic foot ulcer is an initial skin break. For the wound to heal, it is essential to thorough evaluate and prepare it. The second stage is inflammation. When inflammation and a small impact trauma can cause a bleeding beneath the callus, at this point, necrosis or the tissue death develops in the wound, making it uncomfortable to touch and possibly smelling and discolored. The third stage is granulations, which start to show up and they are more uncomfortable and the bigger. And the fourth stage is worse since there is more tissue damage and higher. There are the stages of diabetic foot ulcer images. Next of that. So there are the several risk factors of the diabetic foot ulcers, which is neuropathy, peripheral arterial disease, foot deformities, and the poor foot care. In the neuropathy, there are the several nerve damages and foot deformities, the structural changes in the feet, such as the bunions, hammer toes, and the charcot foot, and that can increase the pressure and lead to the ulcer formations. And poor foot care is neglecting the basic foot hygiene, failing to properly trim the nails, and not wearing the appropriate footwear can contribute to the ulcer development. Next of that is so the pathogenesis of diabetic foot ulcers is a neuropathy, vasculopathy, immune dysfunctions, and the prolonged hyperglycemia contributes to all the above factors to the different mechanisms. Next slide. So the neuropathy are formed by the loss of pain sensation, unrecognized trauma, progression of lesion unchecked, callus formations, tissue necrosis, and damage the beneath callus, development of cavities filled with serous fluid, erupt into the surface and results in ulcer formation. Next of that. So the motor neuropathy are the weakness and wasting of the intrinsic foot muscles, foot deformities, abnormal gait, and ulceration. There are the flow chart of the neuropathy, like the sensory autonomic neuropathies, decreased sweating, and dry and brittle skin, fissures and cracks, and secondary infections and ulcerations are happening. So there are the various examination tests for the diabetic foot ulcer healing, which is a monofilament test. In the monofilament test, you will close your eyes as your provider sweeps a soft strand of nylon, which is monofilament, across your foot and toes, and you will notice when the thread touches your foot or not. In second step, uh, second test, you have a tuning fork and the vibration perception threshold testing. Your provider will place a tuning fork, which is a vibrating device, on various sections of your foot toes to determine whether you can feel the vibrations or not. And pin picking test, your provider will gently press a small pin against your big toe to see whether you can feel anything. The pin will notice will penetrate your skin or not. And fourth test is ankle reflex test. So your provider will tap a unique compact hammer on your Achilles tendon, the strong band of tissue. And the fifth step is next skin examination. We have seen the dryness, cracking, calluses, blisters, ulcers, and any other damages of your old regions. And sixth test is mucoskeletal, which is muscle and bone examination. Your provider will check for the concerns like the bent or the overlap to your toes and Guinean charcot foot. Seventh is vascular blood vessel examinations. We have to assess the blood flow to your feet or not. And doctor have to check the pulse of your ankle and foot and compare the blood pressure in your ankles and arms. If your ankle's blood pressure is lower than your arms, your foot may have less blood flow. Next, a vasculopathy is macroangiopathy, and there is a microangiopathy. And in next, immune dysfunctions. In the immune dysfunction, there is impaired defense against infection. There is a polypharmonuclear leukocyte migration, phagocytosis, intercellular killing, and chemotaxis. Next. So depending upon the wound, which is infected, the appropriate medication for the diabetic foot ulcers are there, which is, and so there are several antibiotics are used for this, such as levofloxacin, ciprofloxacin, cefuroxamine, cilastatin, ampicillin. There are more serious infections. And there are several agents that can use to promote the wound healing. And Regranex bicaplamine gel, which is FDA approved gel that encourages the healthy granulating wounds to heal. Next. There is a metronidazole. There are the various marketed drugs are used under the brand name of metronidazole, which is a metrogel, metrocream notate, and reduces the edema and redness. Hyperbaric oxygen therapy, which is used for the pure oxygen in a contained space. And there are various topical treatments are used, which is promote a wound healing through various the use of growth factors, antimicrobials, and advanced dressing. Next. There are antibiotic treatment, which is mild infections, moderate infections, and severe infections, which is classified according to the size of the wound. For the typically last for 1 to 2 weeks for the mild and moderate illness, and more than 2 weeks for the severe infections. Next. There are the foot deformities are there, which is bunions, hamartomas, and charcot foot. We have already discussed in the last slide. Next. These are the picture of the charcot foot, which is a neuropathic joint, which is we have loss of pain sensation and rarefaction of the bones, and the bony changes are there in the ankle joint, tarsal, metatarsal region of the foot. And when diagnosis is difficult, there is a gallium white cell scanner available, which is magnetic resonance imaging scan are available. Next. There are various methods are used to detect the diabetic foot ulcer, which is a computed tomography, magnetic resonance imaging, and we have to detect usually swelling, exudate, maceration, redness, itching, irritation, and the odor, which is early sign of DFUs. And the benefits of vitamin D include the better glycemic management. Therefore, it is advised routinely check to vitamin D levels in the diabetic patient who have a foot ulcers. Even the connection between the vitamin D levels and diabetic foot ulcer is yet unknown, but the vitamin which is useful to the treatment of the elderly diabetics who have the low levels of the nutrient and the poor glycemic control, and the factor of the diabetic peripheral neuropathy of vitamin D. Next. So these are the objective of the wound measurement. Every patient's wound length and width must be measured at least once in a every 7 days. If there are the planetary methods are used for the wound detecting, but planetary is not accessible, the more basic Luer must be used in the medical records. Next. So there are the several modern methods to prevent of DFUs, like the scaffold fabrication, stem cells, antibiotics, natural products, tropical agents, standard therapies, cold plasmas, and human growth factors, and negative pressure wound therapies to assess the DFUs. Next. So there are the hydrogels and lipid nanoparticles are used to make a scaffolds, and which have a structure which are similar to like a skin. To treat the wound, a scaffolds release antibiotics over a 4 week periods. And there are various advantages of scaffolds, which is economical, environmentally friendly, and effective. And they may be also monitored without having to be turned on and off frequently. So there is electrospoon scaffolds loaded with a glibenclamide, which is and a pioglitazone and metformin and osteolamide, which is a diabetic drugs have to be used for the wounds. Next. So there are various recent advancement in the technology. There are plantar tissue stress therapy are used for the several regions of the foot to detect the high pressure as a result of the untreated repeated trauma. Next. So there are the various reconstructive treatments are used. Next, next. So there are various importance of early detection, which is that have to prevent the complications. The early detection can and proper management of diabetic foot ulcers can help to prevent the serious complications such as amputations that have to promote healing and improve the quality of life. Next. There are the various ways to keep the feet healthy. Check your feet every day. Wash your feet every day. Check your feet every day. They have to check your wound, redness, and other changes in your skin, toenails, and where your shoes are made up. Also, make sure to inspect the bottoms of your feet. Wash your feet every day. Don't wet your feet because it can cause your skin to dry out. After you have to dry your feet, apply talcum powder or the cornstarch between your toes. They absorb the moistures and which can cause infections. If you use lotion, avoid applying between your toes. Third is ask your doctor how to safely remove the corns and calluses. Where there are various surgery are available in the market to remove the calluses and corns on the skin, and trim your toenails and straight across with a clipper. Next. Always wear a well-fitting shoes, socks, or the slippers to protect your feet while walking. Protecting your feet from the heat and cold. Use sunscreen or exposed areas. Keeping blood circulating via your feet. Sit with your feet up. Having your feet checked at your healthcare appointments. There are the various references. Thank you.